Well, erectile dysfunction is defined as a consistent inability to obtain or maintain an erection for satisfactory sexual relations. Now, there's also complete erectile dysfunction or complete impotence, where there's an inability to have any penetrative relations at any stage. So this is where you have complete erectile dysfunction. How common is it? About 50% of men by the age of 50 have some degree of erectile dysfunction. Maybe not complete erectile dysfunction, but some degree of erectile dysfunction. And by age 60, about 75% of men complain about this situation. What are the causes? Well, the aging process works us over a little bit. After the age of 40, testosterone levels drop down by 1% each year. So between age 40 and 70, your blood levels of testosterone are down by 30% as they drop 1% every year. Also, if you're clogging your arteries because you have high cholesterol, because your diet and lifestyle hasn't been great, as you clog your arteries, there's less blood flow that can get to the tissues around the genitalia. That's going to impede, flow and erectile function. Diabetics have a much greater propensity to clog those blood vessels up, so less blood flow can get there. Many diabetics complain of erectile dysfunction problems. So keeping your cholesterol low and your blood sugar low and being fit and not overweight, over your lifetime, it's going to help decrease the likelihood you'll even run into erectile dysfunction problems. Remember that alcohol actually increases erectile dysfunction problems, as do psychosocial problems. Relationship difficulties, lack of attraction to your mate, the stress of life. A lot of stress, of course, as you know, can kill your sex life, kill your sex desire, your sexual desire, and your libido, and your ability to even perform. And an enlarged prostate gland can also, wreak havoc with erectile dysfunction problems. And over time, there are fewer nerve endings that are still alive in the genitalia, so that it takes more stimulation to actually wake those nerve endings up to produce the arousal effect. So just with time, some of those nerve endings that are so sensitive when you're young are no longer there anymore. There's fewer of them. And there are a lot of drugs that can cause erectile dysfunction problems. Beta blockers, which are often used to control high blood pressure, drugs like propranolol, or if you're taking a blood pressure lowering drug and it ends in OLOL, that's a beta blocker. Many diuretic drugs have been shown to decrease erectile function or cause erectile dysfunction. Many antidepressant drugs have the side effect of erectile dysfunction. Excuse me. Anti-anxiety drugs like Ativan and Valium. Histamine blocker antacids like Tagamet and Zantac can cause the problem. Antihistamines like Benadryl, naproxen, and indomethacin, which are anti-inflammatories, often prescribed for joint pain, linked to erectile dysfunction, as well as Parkinson's drugs do as well. Anti-seizure drugs like Dilantin. And drugs that are used in the treatment of prostate cancer that are either increasing, that are blocking the effects of testosterone or having an estrogen-like effect, and certain chemotherapy drugs as well. So those are the things that are primarily causing the problem. What's the medical treatment? Well, drugs like Viagra, Cialis, Levitra, what they're doing is they're helping to maintain a chemical in the blood vessel wall that keeps the blood vessels, dilated, so blood will stay in the genitalia. The problem with the drugs is that they tend to cause this dilation or opening effect across the whole circulation of the body, and that sudden dilation effect can lower the blood pressure quickly, and so the heart has to respond and start pumping. It can go into atrial fibrillation and lead to heart attacks and other cardiovascular complications. I'm not making this up. There's a major study called the Cedars-Sinai Hospital study out of Los Angeles, where they looked at 1,400 adverse events in men that had just recently used Viagra. And they saw all kinds of cardiovascular complications, including sudden death, just within hours of men using Viagra, sometimes for the first time. So there are some concerns about these drugs. Medical doctors also sometimes will prescribe testosterone. I'm not crazy about the idea. If you have any prostate cancer cells in your prostate gland that are just lying there dormant, putting testosterone in your body could cause those cells to start dividing and growing, and now you've got prostate cancer that's alive and could be a very serious terminal type of condition for you. What I really like and what's really underappreciated are the natural herbal remedies, which have been shown in clinical studies to be really useful at reversing erectile dysfunction. So the combination of Tribulus terrestris, Muira puama, Avena sativa, maca root, the epimedium herb with Damiani. These herbs, you may not have heard of them, but when you put them together in a combination, you get an incredible synergistic effect. They increase blood flow to the genitalia, they increase sensitivity of the genitalia, and some studies show they increase libido and sexual desire. Even in women, some of these herbs work really well in women as well to increase sensitivity, easier time reaching orgasm, and also a greater sort of sexual desire response. So the clinical studies on these things are really impressive, although they don't get enough limelight. They don't get the attention they deserve. At the same time, some supplements are actually dangerous, and you would want to avoid them, even though they could improve erectile dysfunction. They actually have side effects that can lead to bleeding disorders and toxicity. So I want you to stay away from those things. Anyway, I've explained all of this.
To know more about erectile dysfunction causes, go to HomeRemedies9.com or like this video and subscribe our channel.